Well, moving on, the European Centre for Disease Prevention and Control has raised its risk level for Mpox. This a day after the global health officials confirmed the first infections with a new strain of the virus outside Africa in Sweden and Pakistan. The two strains of Mpox are now spreading in Congo. The endemic form of the virus called the Clade 1 and a new offshoot called Clade 1b. The ECDC has elevated risk level to moderate from low. More in our next report.
A coordinated international response is essential to stop these outbreaks and save lives.
Tonight, we have all won, and the world has won. I offer you all my warmest congratulations.
We do have vaccine and we have a stock of vaccine. We are also discussing together with a lot of other European countries if we need more vaccine. But with that said, I think the most important thing is that more vaccines are directed into the area where we do have the large spread. I mean, it's much, much more important to try to decrease the spread in those countries and to decrease the risk of spread into other countries.
But you know the serious challenge that's posed by anti-vaxxers, and I think we need to strategize to really push back, because vaccines work, vaccines affect adults, and we have science, evidence on our side. I think it's time to be more aggressive in pushing back on anti-vaxxers. I think they use COVID as an opportunity and, you know, all the havoc they're creating.
A new pandemic is announced by the WHO.
Mpox has been reported in the Democratic Republic of the Congo for more than a decade, and the number of cases reported each year has increased steadily over that period. Last year, reported cases increased significantly, and already the number of cases reported so far this year has exceeded last year's total, with more than 14,000 cases and 524 deaths. Today, the emergency committee met and advised me that, in its view, the situation constitutes a public health emergency of international concern. I have accepted that advice.
And once again, the WHO is saying we need contact tracing.
So we need strong surveillance and good diagnostics. Our diagnostics teams are working to better understand the use of the current PCR tests, the other tests that exist that are out there, to distinguish between Clade 1, Clade 2, and we are looking at how we can get those those diagnostics into country.
They are calling for PCR testing again, which we already know when it comes to identifying a virus. China announced on Friday that they will be screening people and goods entering the country for Mpox over the next 6 months. In the 2024 New Zealand pandemic plan, under the special powers legislation, it states that authorized medical personnel have the power to
Passengers are screened for their temperatures at the airport in Peshawar in northwest Pakistan Friday, one of a number of safety measures put in place after the country's health ministry confirmed at least one case of the Mpox virus in a patient who had returned from a Gulf country.
The health department is ensuring all measures regarding prevention, control, management, and facilities. We have alerted our border health services team at the borders to check all the passengers and screen them for any symptoms. Any suspected patients found will be isolated and managed in Peshawar.
Officials confirm sequencing is currently underway to determine the variant of the confirmed case. This just one day after Sweden reported its first case of Mpox linked to the outbreaks in Africa.
Och fallet är det första The case is the first case caused by clade 1 that has been diagnosed outside the African continent. The affected person has also been infected during a stay in an area in Africa where there is a large ongoing outbreak of Mpox, clade 1.
The clade 1 strain of the virus has triggered global concern as it appears to spread more easily through routine close contact. The detection of the new variant prompting the World Health Organization to declare the outbreaks in Africa a global public health emergency earlier this week. But despite this, global health authorities advising against travel restrictions.
There's no need to close borders when we are in disease outbreaks. Diseases don't recognize borders. People will continue to cross a border, whether it is a legal crossing or an illegal crossing. It doesn't stop a disease from spreading.